Namaskar. Setu Bandhāsana. Let us see its benefits, contraindications, and what exactly happens inside our body while we do this asana. Coming to contraindications, who should not do this asana? People suffering from cervical spondylosis, neck pain, and shoulders, people who are having weak shoulders and who suffer shoulder injury, injury to the neck, injury to the shoulders, injury to ankle joint, and people who have done knee replacement surgery or who suffer osteoporosis. So, for these conditions, they should avoid doing this asana. And people who have undergone heart surgeries, people who have weak heart, medical related weak heart. So, for these people, they should avoid practicing this asana as a lot of blood supply is increased to heart region. Now, let's see what happens inside our body when we do this asana. This is a backward bending asana. This strengthens our hamstring muscles and quadriceps muscles and also strengthens our glute muscles. It strengthens our pelvic floor muscles. So, strengthening our pelvic floor muscle prevents and also cures urinary tract infection due to this pelvic floor muscle weakness. Pelvic floor muscle weakness is the major cause of urinary incontinence. So, people who suffer from urinary incontinence, they can benefit from this practice. And it is one of the potent Kegel exercises. Kegel exercises, physiotherapy exercises, everything came from yoga. Yoga is an ancient art. So, it helps improve the sexual health, and also for asthma patients, this asana is very beneficial as it expands the thoracic region. The lung region is expanded and it strengthens back muscle. The back spine is elongated and also it is toned. I already said it is a back bending asana, so it activates the sympathetic nervous system. It immediately activates, rejuvenates our nervous system. So let's see how this asana is done. Thank you. For Setu Bandhāsana, hands should be near our body, palms facing downwards. Leave 1 feet distance between both the legs, and from here we should flex our knee joint and take our heel as near to our hip region as possible. From here we can take our hand support and bring it towards our hip region. You can do as comfortable as your body is without straining. So legs should be pointed straight direction. It should not be in inwards nor outwards. It should be straight like a number 11. From here, inhale and raise your hip as upwards as possible without straining. When we practice, our chin will touch our chest region. That is perfection in Setu Bandhāsana. Gradual practice you can maintain for a long time. As long as you maintain, the benefits are more. This is Setu Bandhāsana, static pose. We should maintain in normal breathing. In this static pose, we can close our eyes and then relax and maintain. Slowly exhale and bring our hips to the ground. And then release our legs, release our hands and relax. This is static form of Setu Bandhāsana. Now let's see dynamic form. For dynamic form, we are taking Setu Bandhāsana pose. We should inhale and raise our hip region, exhale and bring it down. For doing this asana, we can keep our hands in our ankle joint or keep our palms facing downwards. Anyhow, we can keep it. So 1, 2, 3, 4, 5. This is dynamic form. This can be gradually increased and done till 60 times, 70 times, and as far as you can. So, this is dynamic form. For additional benefits, we can add Ashwini Mudra in this Setu Bandhasana. Ashwini Mudra is contraction of our anal muscles, anal region, and relaxing it. So, let's see how it is done. It's a very powerful practice when combined with Ashwini Mudra. So, we are taking this Setu Bandhasana pose. After taking this Setu Bandhasana pose, close our eyes and slowly do Ashwini Mudra. Contract our anal region, relax it. 1, 2, 3, 4, 5. When we do this in dynamic, it is still more powerful. Inhale, and as we raise our hip region, we should contract our anal muscles. Do Ashwini Mudra. As we come down, release the Ashwini Mudra. 2,
I do what that's not. I thought
3,
I thought you still all open it. Rather stability.
4, 5.
Sure.
Then relax. Today we have seen some powerful poses for incontinence, urinary incontinence, and premature ejaculation, and many such illness. The Setu Bandhasana brings strength in many of our pelvic region and many parts of our body. Thank you. Let's see in the next asana.